And today, for this August function, we have our chief guest Soumya, who is internationally well known, and her father, Dr. Swaminathan, Swaminathan, you all know, the researchers, scientists made a great revolution in India, Bharat Ratna. Now, his daughter Soumya is again worked during COVID time at international level, which is great. In spite of got a commitment to go to Delhi. In spite of this, when we approach late time, but you are accepted. This is a great love, affection towards us. Thank you very much. She used to support for PhD research program. Our own colleagues were not doing it. And today we have our friend Dr. Lil MLA of Chennai, and always with us. Any time you approach, he is always to support us for this. Very happy. Thank you. Welcome. And my friend Nageswareddy, all know, you had listened to you. Such a great friend and promoter of endoscopy surgery. And today he is going to reveal Right from Achievement Award. I'm very happy about it. And today I'm very proud to say he is the, to my knowledge, only one to receive. It is not Padma Shri Bhatam Bhushan, it is beyond Bhatam Bhushan and received recently from President of India. Congratulations and well wishes. You are always motivated for all young scientists. And the question was asked to, are you jealous? Anybody is there? Probably I may be jealous of you, the way you admire this. I am very welcome, accepted to be here. And our international faculty are here, every one of them. You see last 2 days doing life surgery at GEM Hospital and also deliberation giving a talk. Such a wonderful talks, really admiration. All young people, delegates participation. The companies are selling, none of the people are coming out to listen because that program is so wonderful. Every one of them are sitting it. No coffee break, no lunch break. They continued so much. And I thank all the foreign faculty, both international and national, to be last 2 days spending all of you. And thank you very much. I welcome all of you. And more than that, that interest learning, minimally invasive, and youngsters participating as delegates, I welcome all of them. Very happy about it. And the press and friends, and without their support, and nothing can become more. Dr. Kalam, when was President of India, he told me, doctors, medical or surgical, whatever you innovate, until people become aware, that is not going to reach. That way, press people helping us to get into the common people. Very happy. Welcome all the press people to here. Second thing, this is new. This is as organized chairman, I feel proud of GEM Hospital. GEM, I don't know, many of youngsters know, it is a gastroenterology medical center, a dedicated gastroenterology practice. The subject which want to serve the community, that's why 2000 we established GEM Hospital, Coimbatore first time. Then subsequently, of course, we have a chain of hospital in Chennai. You have seen that the last 2 days, even day before also, we had a training course there. Everybody appreciated the training course. They can do hands-on program and this. They are very happy coming and tell me, sir, we learn, very happy about it. So this is a dedicated center. When we started at that time, people also said, single subject you are starting, don't want to take risk. Why not you go? No, we are not a business people. We are a science promoter, gastroenterology science. So nothing, need not worry about money, and what we know we'll teach. What we know we serve the community. What we can innovate, we'll innovate, and ultimately be part of the society. So we love the people, be part of the people. That way, GEM Hospital stand with this. And equally, when we started that time, not much center, only Nageswareddy, Hyderabad, and a few of them here and there. Now, because of Nageswareddy, because of teachers, many of the people today across India, even at taluk level, people are practicing so high quality minimal invasive. But today the discussion going on, the concept, one side the talking surgeon means open surgeon. That is all gone. Oh, no, if he talk about anything surgery, it has to be minimally invasive surgery. Again, if he talk about interventional, it has to be focused. So here, marriage happening between the interventional radiologist, physician, and surgeon commit together, it became a new specialty now. That is why we can do much more. That's what last 2 days you all listened to it. So today, unfortunately, I could not talk interface between emerging it. So today, hereafter, no, surgery means minimally invasive surgery, and minimally invasive therapy is a correct word to use. Physician and surgeon can come together to work for, and we can have a consensus what to do the best. Ultimately, the patient is worshipping, That's why it always, Jim, take a folded hand in front of every patient before you deciding a treatment protocol, because so many things will happen, but patients should receive the best care of which. That way, this conference, from my heart, I'm saying, very successful because of the faculty and because of the delegate participation, interaction so well. And so I'm very happy about it. Indian surgeons finding lot of difficult and doctors finding difficult because of strategy. If you look at system in India is something not like Western countries. Taluk, private colleges, medical government, like an institution like AIMS, lot of things. In spite of this, every doctor, physician, surgeon, irrespective, they try to do the best for the community, and lot of innovation have come from India as well in bar with the Western countries. That way, I started and minimal invasive onco surgery is today we have to promote well, and still in India it is not happening like Western countries. If you go to Korea, if you go to Japan, Taiwan, highest percentage of cancer today taken by the minimal invasive, maybe laparoscopy, robotic. Japanese government pays 50 to 100% remuneration more insurance because patient gets the benefit. So that means we have to push little more in complex surgeries, and particularly in the minimal invasive way. All of us jointly work it, and this is the first SCOPE program. And I congratulate my own team, Dr. Vinod and the entire team, taking a last few months, and great effort have taken inviting all. And in spite of short notice, our international faculties come all the way from different countries, states and Japan, everything. I am thankful to all of you, appreciate your gesture towards us. And this scope is truly a good scope for India, and we definitely in this part of the country will work it continuously to do the best care. And this take opportunity to thank every one of you with a folded hand. Any shortcomings, and always it happens, part of it, not intentionally, we try to do. Our hospitality people, organize, everybody wanted to do help and be part of informal and be with us. Thank you very much. Welcome all of you to this meeting.
I'm sure all of you did, where we heard from some of the stalwarts in gastroendoscopy, but talking about different aspects of their lives, their successes, their failures, people who inspired them, and also some words of wisdom. So I'm not going to talk about endoscopy because I'm sure everyone in this room knows more about it than I do. But I just wanted to say a few things about research, about innovation, and also some lessons that I learned, during COVID when I was the chief scientist at the World Health Organization. So from a young age, I was always interested in research. Maybe that was the environment in which I grew up. But I wanted to be a neuroscientist or a actually a scientist going into human genetics. But as it turned out, I then ended up going to medical school. That was not my first preference. But even after going through medical school, I continued to remain absolutely committed to a research career. And I must say that when I came out of medical school, or even during my years there, no one talked about research, about medical or health research. None of my faculty members, teachers, professors, in fact, they were all extremely disappointed and said that, I should have had a brilliant career in clinical medicine. And why did I want to go into pure research? It was when I went to the US to do a fellowship after my MD that I really got inspired by some of the mentors at the University of Southern California in Los Angeles at the Children's Hospital, where I learned what research methods is all about, how to ask the right questions, how to design and it was all clinical research, mind you. It was not basic lab research. I was also very clear. I didn't want to be in a lab, and I did not want to be in an animal facility experimenting on animals. I wanted to do clinical research on clinical problems, day-to-day clinical problems. And so I did my fellowship in pediatric pulmonology, and then when I came back to India, again, again, I was very committed to working in India, so I spent 3 years abroad and came back. And again, everyone I met told me that I should get into clinical medicine, but of course at that time the subspecialties were hardly known. So pediatric pulmonology was not really anything anyone was aware of, but still we had a huge burden of asthma, of many other lung diseases in children. And the other thing was I could not find a job where I could do some clinical practice, research and teaching. So things have changed, of course, since then, and what I see today is that there's a lot more research happening. In fact, outside the government system as well as within the government system, and some of the best research that's come out of India in health, I think, has been in private settings or in NGO settings, in rural areas, tribal areas. So I think the lesson is you don't need high tech, you don't need big, huge labs or facilities to do high quality research. You need good powers of observation. You need a deep interest in improving the situation that you see, and that's what we heard, I think, from our innovators today, that when they found a problem, they wanted to tackle it, they wanted to make things better for the patient. So I think research is all about making things better and improving on what you found it earlier. And so this is why everybody must and can do some research wherever you are, because really the goal is to use your experience, wisdom, and the clinical material that we have in India. I think it is unparalleled. You will not get this anywhere else in the world. The numbers of patients, any condition, any disease, just because we are a population of 1.4 billion people, you can have the largest case series in the world. I think our challenge is putting together good clinical observations, keeping records, having cohorts and longitudinal follow-ups, and then being able to analyze that data. If you have lab biomarkers, pathology, scans, that adds, of course. And so when I was in the ICMR, we really expanded our investments, and ICMR continues to expand investments in centers of excellence. Both now they've opened up to private places as well. It used to be restricted to government, but now they have a scheme where you can have collaborating centers, ICMR collaborating centers or centers of excellence you can apply for. Some of them are funded, some are unfunded, but you get that, just like WHO collaborating centers, you get a stamp from WHO, you get to do a lot of work, but you don't get any funding from WHO. So I think inculcating interest in research in medical schools, I think that's still a challenge for us. Whereas in the West, you have many more opportunities to undertake research when you're in, starting from school, but then you go into college, medical school, etc. So we need many more mentors like we have today over here, and people who you can look up to, the youngsters can look up to, who have a very busy clinical practice and yet have found time to do some path-breaking research as well as innovation, in equipments and in devices and things. The second area is around collaboration. So during COVID, what I noticed was that there were a lot of things that were terrible during COVID. I think we had experienced a huge amount of pain and fear and loss. But what stands out is the fact that we were able to find a solution. We were able to find a vaccine in less than a year, which has never been happened. It's unprecedented. It only happened because people came together. And what I observed was that whatever people had been working on prior to COVID, they dropped that. And they said, let me use my expertise and my knowledge to contribute to COVID. And so you had thousands and thousands of scientists around the world who were literally producing new knowledge every day. And being in WHO at the center of that, I could get this feeling of every day, being updated, learning something new about the virus, about the immune response, and about clinical care, clinical trials that were happening. Of course, we found a large number of clinical trials that were underpowered, that were not well designed, and that did not answer the big public health questions. There were very few trials that were done that had a mortality as an endpoint, that had those public health relevant outcomes as endpoints. So that was another lesson. How can you do large clinical trials, even in the middle of a pandemic, high quality, to prove which drugs work and which don't work? Very important to generate that evidence. Otherwise, there's so much waste of resources and unnecessary use of medicines which are not effective. So the concept of doing these large trials for public health outcomes, I think, is something we need to adopt in India also. And this is where collaboration becomes important. I think we have to foster more collaboration between hospitals, between doctors, between the specialists, like all of you, for example. If you wanted to test something new, I think Dr. Nagareddy was saying how difficult it is now to bring a new device or to bring a new innovation. So ICMR is trying to help. They've set up something recently called MedTech Mitra. So anyone who has an innovation can actually contact ICMR, the MedTech Mitra program, and they actually guide you on what you should do next, what should be your study design, what kind of trial would you do, so that the evidence becomes usable, can be put into guidelines, can be recommended by government. So over a period of the last 10 years, I think we have evolved in India on how we generate and use evidence for policy making. And again, thanks to the ICMR, my predecessor had already started thinking about expanding research. When I became the DG ICMR, we set up the Health Technology Assessment Program, which today is vibrant, thriving, and the Ministry of Health uses health technology assessment to decide whether to take an innovation into to scale. Because as you know, India, again, you want to put something in there for the public health program, it's a huge investment you have to make. So to be very sure that it's the right investment, is it the right vaccine for the right population, is it the right device that you're bringing in, is it the right monitoring system or diagnostic, whatever it is, after it's established efficacy in clinical trials, it goes through this period, this exercise of a health technology assessment program. It's found to be cost effective or very cost effective, then it's incorporated into the national programs. So this has got really strengthened over years, and now the next one is this MedTech. How do we actually promote more innovation, affordable innovation, and our own people actually generating this type of data? But it's difficult to do the studies, to generate the evidence. You need patients, you need partners, you need funding, and ideally you need a private sector partner who will manufacture the device and take it to the market as well. So a lot of innovations and startups that face challenges on taking that journey, but we can see some very good examples. A company which manufactured on the point of care diagnostics for tuberculosis called TrueNat. Worked for many years, and I've seen their journey, and today TrueNat is used not only in India but around the world. It's also recommended by WHO as a rapid diagnostic, molecular diagnostic for TB and for at least 15 other infectious diseases. So patience pays off, definitely, but now the systems are also getting into place. But I wanted to stress that collaboration is important, and that I have now seen a few examples in India of specialists who collaborate across cities. For example, the ICU network. You can do clinical trials. There is the National Cancer Grid that runs, the Tata Memorial Hospital runs. National Cancer Grid connects several hundred, I think more than 1,000 physicians around the country, and jointly they do these CPCs to discuss cases, pathology grand rounds. They do clinical trials together, and the most interesting thing, what has happened with the cancer grid is the price of anti-cancer drugs got reduced by over 80% because of pooled procurement. So again, the power of volumes can bring down the price, and that ultimately that benefit actually goes to patients. So we have many such examples in our country that have shown how collaboration can do not only high quality research but immense benefit to patients, because we have to understand that many trials which are done in the West and drugs get approved you know, it's not that they won't work in India, they will, but is it the right combination of treatments? Our demographic, our genetic background is a little bit different. It's not that we need to repeat all the clinical trials in India, that's not what I'm saying. But like the Cancer Grid has done, they've tried to make the treatments for leukemia and other cancers more affordable. So you can always try, different doses, different combinations, the frequency, the periodicity, and so on. And very many simple innovations like kangaroo mother care for newborns. It's just a very traditional way of keeping the baby next to the mother's skin. In all our communities, traditionally mothers or grandmothers do keep the baby very close, but that tradition had worn off. So a clinical trial was done to show that this kangaroo mother care reduced neonatal mortality significantly, especially in low birth weight babies. And then further on, they went on to show that it also improved cognitive development, improved breastfeeding, growth, and so on. So it's not that clinical trials are only for new drugs or high technology. A lot of things like, the famous trial that was done in Gadchiroli by Dr. Abhay Bang and Rani Bang.
Maneuvers inside the cave of the alimentary canal. The great adventurist, the various adventures you undertake for every journey you take for each and every patient is surmountable. Sometimes the cave is bloody, the cave is aggressive, catching a feeding artery, identifying the culprit lesion, taking a tissue biopsy. Thanks, my friends. You've been really good help for our practicing physicians to make a diagnosis. Welcome to Chennai to the external world delegates. You're in the right place because Chennai is the cusp area of both East and West practices, of the best medical practices of the entire world summating at one point. I congratulate the Society of Gastroenterologists and GEM Hospital to organize such a big conference for summation of various ideas between the East and the West at one point, that too in Chennai. We come from a unique state when compared to the rest of the country because our health system has been the best model to emulate for any developing nations. Many international epidemiological reports or anthropological reports or medical human resources are favored Tamil Nadu model of health delivery system. Here we have an excellent proposition given to the world, especially in developing nations, where generations and generations of education has been limited only to elites. So Tamil Nadu is a foremost state who broke the elitism in medical fraternity. And I stand here as a proud person belonging to this health system, where we reached a concept of reaching healthcare to the commoner. What's the solution is to make the commoner as medical doctors. We have the special affirmative action in our public health system, public health education, so that we have representations from all type of spectra, first generation doctors, socio-economic backgrounds, as endoscopists, medical gastroenterologists. Attending an international conference of this kind is a unique proposition when compared to the rest of the country. It takes at least for a simple consultation or OP consultation in various Western countries, we did a study about what is the time taken for each and every patient to see a physician. In US it takes 20 days, in Italy it takes 10 days, in Arab nations it takes 10 days, in Spain it takes 9 days, in Sweden it takes 7 days, in France it takes 6 days, in Germany and Australia it takes 4 days. But for me, at night time in my clinic, if I see an 8 o'clock patient, I can do an endoscopy the next day morning. That's the ecosystem we have developed in our Tamil Nadu. I congratulate the organizers to have a brainstorming sessions in this particular area. I would concur or align with Soumya ma'am, who gave us a brief picture about the research ecosystem of our particular country. The problem is, in a vast country like us, a pluralistic country like us, I think our research modules and healthcare should be decentralized. We should have a decentralized approach. A union or a center can give a framework, a general guidelines. But all these regulation issues which were discussed in the previous session, it can't be a single point or a center point. So it has to be diversified and decentralized. So a state like Tamil Nadu, which has been doing a pioneering work in tertiary care health system, can have their own mechanism of an R&D regulatory system with guidelines received from the center. So each time or each approach, the journey taken for a research paper from an hospital to a state to a unit with this many kilometers above us, and the regulation and understanding the research milieu, the time gap being delayed is a curse to our system. So I think we should have a decentralized system, especially regarding public healthcare and research. Ma'am was talking about collaboration. Yes, collaboration is vital. We have a huge clinical patients milieu in our public health system. That is at one point, it is operating in silos. The R&D and research are with the industry and with the private sector. So this gap has to be met. This gap has to be summated. So progressive steps have to be taken, especially in these lines, to link the healthcare industry with our public health system with good research output. And that is the only way we can take it forward. With this step, I'll try to give you some good news from state of Tamil Nadu. We have started a medical devices research park in Oragadam. We are inviting various manufacturers across the globe to develop a manufacturing ecosystem within Tamil Nadu. So this medical manufacturing ecosystem hub will collaborate with the various healthcare provider systems of Tamil Nadu state, especially both private as public. Here we had discussions of innovations getting delayed, approach getting delayed, and manufacturing sector. So when country is going on in like in Make in India initiative, now we have started something called Make in Tamil Nadu initiative, where young entrepreneurs, especially in medical and medical related fields, where the government will facilitate their support system right from its inception to the end point, as well as matchmaking to various angel investors. With that note, that type of research should collaborate with the community. See, now I've gone through the brochure of the various topics which has been discussed. The organizers have covered the entire stretch at various atlases, the AI intersurface and everything. We should have regional data or regional specific data to collaborate. What about the endoscopic appearance of people belonging to Madurai or Virudhunagar or Chennai? What is the food milieu which is going to alter their gut habits? What is the microbial data of each and every gut? So type of sub-regional data will be very important so that it be collaborated with a research module as well as with the public health system to delivery to the larger population. So that is the only way where we can reduce the cost. That is the only way where we can revamp a registration system. That's the only way we can collaborate so that we work to the common goal of health for all. Thank you, friends. Thanks for the patient listening. Kudos for all the future endeavors. And as a public health representative, as a fraternity man belonging to you, I'm always there to support you. Thank you.